the patient, I mean, the procedures, whatever we do, it is always, there is a challenge. This is what I have seen. So, can you hear me? Am I audible?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
So this is what I have done, because I'm not talking about, how a nursing procedure is, collecting article, performing the procedure, replacing article, document, not the entire thing, but a very few things a nurse should know. That is what I'm focusing. So what I have done, it's my long-term desire that I should get into YouTube, and the title which I have given is Nursing Skill Tip. So Ms. Pooja will help me to play one of the videos that is about the broad and skin assessment. So when we talk about the broad and skin assessment, we all know, we have seen that blue color sheet, we have taken a printout, and it's quite a big information sitting in that every column in the square. So we have every accreditation, we say, what is the scale which you use? We only say broad and skin assessment. But what is our knowledge in depth about broad and skin assessment is very limited. That's what I have seen, basically, what I see every day. So what I thought, how to make this nurses to register this broad and skin assessment in their brain. That is what my focus is all about in my nursing skill tip. So once you see this video, then I will give you an explanation. I want all of you, I'm glad many of you are joining. Please come out. I'm sure many of you, even from nursing college, many are joining here. So I want you to talk to me, ask me questions so that there will be more clarity end of this program. That is what I expect. Feel free. It is our session and you need to talk. So Miss Pooja, can you play the first video?
Sure, ma'am. Sure. Allow me a moment. I'll just play it.
No. Can you all hear audio?
No, ma'am.
No,
Video.
ma'am.
No, ma'am.
Yeah.
Okay, ma'am.
அப்படியா சாப்பிடுங்க நூடுல்ஸ் அதை போட்டு சாப்பிடு சுட்டு கூட நல்லா தான் இருக்கு நான் இது சுட வச்சேன் சாப்பிட்டுக்கலாம்ல பொங்கல் கட்டி இருக்குது
Ma'am, voice is not audible.
Yeah, we can't hear the voice. But is this
Okay.
the one that I sent you right just now?
Yes, ma'am. These are the YouTube links you have sent me.
Yes.
Okay, ma'am. Just a minute. I'll try
Yes,
once
yes.
again. Is this audible now, ma'am?
No. Hello. Veera, can I call you, Veera? I am in a seminar. I'll call you after 1 hour. Yeah.
I think,
Phone is there? Phone is there?
Voice is coming?
No.
You're getting things? Is this voice? I think this is the YouTube video. I'm not able to share the voice. Try once again.
So this is all about nursing skill tips. So today I want to talk to you. Sorry, we will try to get it. They're working on the video. So this is about the skin assessment, like broadened skin assessment. So if you all can remember, there are 6 aspects of areas, which this is what I am telling there. 6 aspects where we, as a nurse, we need to remember. The first aspect is if your patient is having a sensation, like for example, if he is lying on his back, whether he has a sensation on the skin or not, whether he's able to feel, like when we lie down, when you feel after some time, when you really feel it's hot or not okay, then we change the position. When a patient is not having sensation, definitely he won't move on his own. He needs your help. That is one aspect. The second aspect of assessment is that skin area, which is where the patient is lying, has a moisture. So the moisture, what do you mean exactly? Is it with urine, or is it with fecal matter, or is it having a lot of sweat because he's lying, or anything which can create moisture there? That is what it is. So first level is there a sensation? The second level, is there a moisture, anything which is there, which is hurting the patient? That is another aspect. So the third aspect is, we call it the mobility. This is what it is. So is my patient able to move on its own? That is what it's one important thing. That is what we call it mobility. The fourth aspect is that patient is able to have that activity. See, once he starts moving, he's mobile, then definitely activity. Is able to walk. So always the mobility, you connect it next is activity. Is able to walk on his own, go to the toilet. So this is another fourth level of assessment. The fifth level of assessment is nutrition. So what I'm telling, why I call my teaching as nursing skill tip, because we need to remember, everything need to be there in your brain. Then only spontaneously you will be able to do the assessment. So, sorry, how do you think you remember this fifth aspect is nutrition? So traditionally, we all eat with our 5 fingers, right? Yes or no? So this is what you connect, 5 fingers. When you think of your 5 fingers, eating, traditional Indian method of eating, connect it with the nutrition. Then the fifth aspect of assessment is nutrition. The sixth aspect of assessment is friction. So that is what it is, friction. So when you think of friction, like what is I'm lying on, especially the bed. The bed is hard. Have I provided alphabet? Is there any wire going underneath? Is there anything unwanted thing is there on the bed which is hurting my patient? So which can create friction. Sure, we call it friction, which will hurt my patient back and it will create pressure ulcer. So this is what is broadened skin assessment is all about. 6 area of assessment where you will come to a conclusion that my patient has a chance of developing pressure ulcer. So this is what you all have to remember. 6 aspects. Another aspect is 4 important things. One is you will have to remember 4th thing, that is poor. Poor is very bad. Fair, good, excellent. You have to remember these 4 aspects. So that is what is important. One is poor. Poor is very extremely bad. Poor. Remember that. Poor, excellent, that is extremely good. Or then next level is fair. Poor, fair, good, excellent. So you have to remember 4 things. First I told you to remember 6 things. Now you'll have to remember 4. So I have created a chart. So all the 6 aspects of your assessment will be on top. These 4 aspects of poor, fair, good, excellent will be lying here. So for a poor, you give a mark of 0. Fair, you give a mark of 1. So like that, you will be giving a mark. So where I wish I will be able to show you in the picture. So what is happening now? If your patient is having the mobility level is very good, excellent, then you give a mark of 4. If your patient nutrition is okay, good, then you give a mark of 3. If your patient's mobility or activity is poor, then you give a mark of 2. If your patient's activity is fair, then you give a mark of 2. So like this, you put all that mark. Then you see what I'm trying to tell you. Always when you do an assessment, you get a number. That is what Braden skin assessment scale. For everything to measure, you need a scale. If you measure with that scale, you come to a conclusion of a number. That is what we are looking for, that number. So what is happening now? You count all these together, you come to a conclusion of one number. That all are 6 aspects. So now, how do you know that my patient is having a mild, moderate, or severe? So we have another scale, which is also I will be able to show you. So in that scale, what is severe? Severe is always a lesser number. So again, 6 will be the very severe number. So always remember 6, number 6. So if you put number 6 upside down, it will be 9. So you can always remember, this is what I'm connecting with one with another. So that 6 to 9, remember that. Can you remember 6 to 9? Because 6, if you make it upside down, it will come to 9. So connect with something so that our brain can remember. 6 to 9 is severe. That is, if my number comes to one of these numbers, if our total number comes to 9, that means I am between, my patient is between 6 to 9. That means he has a high, very severe, not high, severe chance of developing pressure ulcer when he is with me. If the total number comes between 10 to 12, that means moderate. So how do you remember the 10 to 12? 10 standard, 11 standard, 12 standard. This is what in India, it's a very crucial period of your education. Your mother will say, go study, you are in 10th standard, you are in 11th standard, you are in 12th standard. You have to become like this. Please remember, connect with something. 10th standard, 11th standard, 12th standard is a moderately severe score. When your total number comes between 10 to 12, you as a nurse, you think, yes, my patient has a moderate level of developing pressure ulcer when he's with me. Then teenage, what is mild? Teenage, 13, 14, 15, 16, 17, 18. So 13 to 18 is mild. When your total number comes between 13 to 18, you will know my patient is having a mild chance of getting pressure ulcer. So each level, mild, moderate, severe, depending on that, I will modify my nursing care and make sure my patient will not develop pressure ulcer. So this is what is all about your Braden skin assessment. So it is always in paper. Bring the paper when you are doing assessment. Now you are having everything in your brain. So if it's possible, I will be able to show that video. You will understand better. So this is the way the Braden skin assessment for 6th level of, have you all understood? Do you have any question, please? No questions, sir? James,
Now, what
all
is the
understood?
difference between friction and shear, ma'am?
Both are same meaning. If you think
Then why we
Braden
have
skill
chosen
assessment,
this,
see,
ma'am?
friction is, shearing is same thing. It is developing, it is slowly peeling off the skin. It is like, shearing. That is the English word. Friction is, again, it's continuously, rubbing,
One another.
shearing, rubbing, all that. So all these methods, it is coming to the conclusion. So this is what it is. Anything else? Lakshmi Prabha, is it?
Yes, ma'am.
Okay, good.
The numbering.
Anybody has any other?
The numbering
You
is.
want me to repeat the number?
We couldn't hear, madam. I couldn't hear it. Like about the activity and the nutrition.
Okay, Usha, you want me to repeat? Okay.
Yes, madam. Yes.
Yeah. See, now this number, I told you first to think of 6 aspects of assessment. You understood?
Yes, ma'am. Yes, ma'am.
Poor, fair, good, excellent. You understood?
That I got
So
1,
now,
0, 1, 2, 3, 4.
Zero. No zero. It is 1, 2, 3, 4.
What?
Poor is 1, fair is 2, 3 is good, 4 is excellent.
Excellent. That I got.
Okay. See now,
Yes,
each one you will give. See, for example, my first level you take it. First is what? You have a sensation or not. Yeah? Your patient sensation is going to be poor. Yes? You will give marks. You will give 2 marks.
2 marks. Okay.
Yes, because you are giving poor is 1, fair is 2, good is 3, excellent is 4. This is fixed. 4. So what is my patient? See, my patient's next level is moisture. The moisture level of my patient is good. So what you will give? Automatically you will give 3. 3. Understood now, Usha?
Yes, ma'am.
Okay. Same thing. My patient's next level will be mobility. Mobility is poor. Then you will give 1 mark. Then my patient's activity is good. You will give 3 marks. Okay. My patient nutrition is excellent. You will give 4 marks. Okay, my patient friction is fair. You will give 1 mark. 2 marks. So 2 marks. So you count this mark. Count this number. You come to so now you tell me what your number is. Total is what? What number total?
Patient moisture is good, 3. Mobility fair, 2. And nutrition good, 3. Sensation fair, 2. Activity good. Activity poor, I'll give 1. So 5, 10, 11. 11. So where 11 will come? 10 standard, 11 standard, 12 standard. I said moderately severe.
Yes, moderate. Your chance of pressure ulcer is moderate. You understood now? Anybody else has question? Anybody? You all understood? So this is what I have created this. So simplifying the same, whatever we need to assess, the severity we put it. So when you combine this together, you come to a number. And even this I told you how to remember. Between 13 to 18 teens, from 10 to 12 is your moderate, and your severe is 6 and 9, 6 to 9. I'm sure 6 if you remember. Always you can remember the 9 also, 6 to 9. So this is what is about our broadened skin assessment, the modified method. So you don't need to bring any paper. Without any paper, as soon as the patient get admitted, you can just go through all this and come to a conclusion. What is the severity of your pressure ulcer? So this is what it is. So we'll go to the next level 1. So now, I don't know, without a video. 1 second, just hold. Huh? Rice dinner. I'm Dr. Rohini Paul. So this is all about nursing skill tips. So today I want to talk to you about the Braden skin assessment. For nurses to see the Braden skin assessment paper and to do the assessment in all these years, I find it is very difficult. So how do you store this in your mind? That is what I'm going to talk to you now. So as you all know, the Braden skin assessment, there are two aspects. One is we have 6 aspects of assessment. So how do you remember these 6 aspects? So I'll make it very simple for you. First level, what do you do when you assess the skin? It is the skin of the patient, how the condition of the skin. So always, is that skin patient has sensitivity is there or not? That is one aspect. Then, if you pour moisture, water on it, is that patient's skin has lot of moisture? It could be with the urine, it could be with fecal matters, it could be sweat. So that is what the second level you will see. The third level, how do you remember? 2 things you can connect together. One is mobility. Can my patient get up from his bed and start standing or walking? Then you connect it with the activity. So the first is skin, second is moisture, the third is mobility of your patient. The fourth aspect is activity. What is the fifth one? It is nutrition of your patient. How do you remember? Connect with the fifth. Think traditionally we Indians eat with 5 fingers. Remember that 5. Connect with nutrition. You can remember that. So the fifth aspect of your Braden assessment should be nutrition. The sixth aspect will be friction. How you are talking about friction? It is does my patient has a tube coming under the bed? Have I provided the alpha bed? Have I provided the proper mattress? Is there lot of wrinkles on my bed sheet? Have I not removed it? So all these are connected with friction. Definitely my patient will have pressure ulcer. So this is what the 6th aspect, my patient will develop pressure ulcer. This I want you to remember. Another 4 things I want you to remember. When you talk about all this for your patient, how good it is. So where you can remember, poor, fair, good, excellent. Remember this. Fair, poor, fair, good, excellent. So I am showing you a picture which I made it. Make it very simple. So each aspect you give 1 number. So this is what it is. Put this 4 aspect of poor, fair, good, excellent. Put that all 6 aspects of what we have assessed. Connect with each 1 number. For example, my patient, how is his sensation? Is it 1? Then I will call it as poor. If my lot of moisture, if I think it is fair, then I will remember 1 number. Finally, if the nutrition is good, I can think of 3. So when you look at the picture of the scale, you will be able to understand. So you add all these numbers as we always do for Braden skin assessment, come to a conclusion of 1 number. That is what is the score for my patient. With that, how do I know? It is mild, moderate, and severe. That is a scale. So how do I remember that also? Always remember the number 6. So 6, if you make it upside down, you can come to a number as 9. 6 to 9 is very high chance of pressure ulcer for my patient. I'm sure you can remember. 9th, 10th, 11th, 9th standard, 10th standard, 11th standard. It's a very crucial thing in India for all children. I am sure you can remember. That is your high level of pressure ulcer. Remember that. Then the teenage, 13, 14, 15, 16, 17, 18. Remember from 13 to 18 is moderate. So how do you know? If my total number comes between 6 to 9, I say he has a high chance of pressure ulcer, then I should take care very seriously about my patient to prevent pressure ulcer. Between 9, 10, 11, if that score total comes, then I'll say moderate, or you can think of severe. Think of 3 different levels. Then if it is 13 to 18, it's a mild mild severity, so that how do I take care? So this is what it is, the Braden scale. You remember You don't need to take a paper because none of us go with a paper to assess the skin. If you can remember this in a simple way, I'm sure all of you, as soon as you look at your patient's skin, you will be able to assess without the paper in your hand. So I'm sure you understood this. The PPT also will give you more explanation. With that, I'm sure you will be able to do a better assessment. Thank you. Can you all hear me now? Yes. Do you have any questions now? I'm sure you have more clarity now.
Yes,
right? Okay. So next, one more thing. I'm sorry we had a lot of our network issues. We had some time wasted. So quickly I'll finish with the next video. Before that, I'll give you a small brief explanation. This is about our 12-lead ECG checking. So now many of us, because I practically see our nurses, some of them are 5 years, 6 years, 7 years. They all are checking ECG. But when it comes to few of the details, they have a lot of questions or they are not having clarity. So this is what I thought, that 12-lead ECG. Here I'll be explaining only about the chest lead placement. That is what I'm going to focus here. So I'm not going to talk about it. I will straight away play the video. So please have a look, and then I want you to ask me questions. So I'll be able to answer your questions. Can you all see this? Hi, I'm Dr. Rohini Paul. So this is about the nursing skill tip. So today I want to talk to you about a very important process. Can you all see this?
Yes, madam, we can see.
Okay. That is the chest lead placement in the 12-lead ECG. So always the nurses have one question, that is, this particular ECG is called 12-lead ECG. But we are only fixing 10 leads we are fixing, that is 6 of chest leads and 4 of the limb leads. So total it comes to 10. Then why is it called 12 leads? So the answer is, we are fixing 10 electrodes, but 12 perspective of heart. Could you mute your mic, others, please? Please mute your mic. Some of their mic is on.
मंजू जी आपका माइक ओपन है, कैन यू प्लीज म्यूट इट?
Please mute your mic. I don't know who is.
Ma'am, its name is Manju. Yes.
Activity through different angles of the heart. You all know 3-dimension. Our heart is pumping like that. It is an organ. So what happens? 2 electric, but 12 perspective of heart activity through different angles of the heart. You all know 3-dimension. Our heart is pumping like that. It is an organ. So what happens? 2 electrical plane, which is coming in the horizontal and in the vertical, which is representing the other 2 areas. That is why, though we fix only 10 electrodes, we are able to get that activity of the heart as 12-lead ECG. So now, what is the method of fixing this 12? Where do you fix? As you all should know, 4th intercostal space, our heart is situated. So remember this 4. Please remember 4. That means, why I am asking you to remember this 4?
fourth intercostal space. See, this is the clavicle bone. From clavicle, next starts 1, 2, 3, 4 ribs. What is intercostal? The space between two ribs are called intercostal space. So, fourth, remember this, 4-chamber heart has got. Somewhere you connect with something so you will not forget. So, everybody knows heart has got 4-chamber, fourth intercostal space. Where will I place the first lead? Always you give importance for your right hand. So, fix the first lead in the fourth intercostal space in the right side of the sternum. Exactly on the left side of the sternum, the second lead you place, fourth intercostal space. Don't fix the third immediately. You go for the fourth one. So where do you place the fourth? You have the clavicle bone on the left side. Exactly middle clavicle, you draw a line on the fifth intercostal space. So that is what your fourth lead. The third lead will come exactly, draw a line between the fourth and the second. You get the third lead placement space. Again, where do you fix your fifth lead? That is your anterior axillary. See, your axilla is this axillary area. This is the mid axilla. This is the anterior. This is the posterior. So you have your anterior axilla on the fifth intercostal space. You fix the fifth one. Then the mid axilla on the fifth intercostal space. You fix the sixth one. So here, please remember, two areas on the fourth intercostal, that is your first and second. The fourth, fifth and sixth will be in your fifth intercostal, and the third will come exactly between the second and fourth. So this is the way it should be fixed. The only reason I am doing this, if you don't fix the lead in a proper way, your ECG will come out wrong. And if your ECG is going to be wrong, and the patient diagnosis will be wrong. So everything lies on the nurse's hands. So I want you to learn this and do the method as it is been expected. Thank you.
Somebody's mic is continuously on. I don't know who it is. It's really distracting. Okay, so I'm sure I don't need to talk anything more. Can you all hear me?
Yes, madam.
Okay, so this is what it is all about. Who is Manju? Manju, will you mute your mic? Manju, will you mute your mic?
10 minutes before the BD dose.
Ma'am, you can mute everybody and then you can come back, unmute yourself, ma'am. That will be better. Just hold that button and mute you all.
Because I do it with the iPad. That's my problem. Can you do it, Miss Pooja? Okay, now she has done it. It's okay. Yeah. Okay, I'm sure all of you understood how important it is, your ECG. So separately, I'll be doing one more video on the lymph lead placement. I'll make it very simple. So do you have any question in both of this?
No, ma'am. Thank you.
So it's very simple because one is I made it very clear. How do you identify your intercostal space? How do you remember this first and second and the fourth? And of course, this all, because many of us have doubt which will be coming fourth intercostal, which will be fifth intercostal. Make it very simple. The last three will be in your fifth intercostal. The first two will be in the fourth intercostal, and your third is in between this. So make it very simple. And I am sure that will help us to exactly do the right way of checking ECG. Anybody has any questions? So one more thing I will continue to tell you. So if all of you, if you feel it is useful, just go to YouTube, Dr. Rohini Paul. If you click on all these videos will come. So you can always view it and whatever it is. So we will be continue to upload a lot of videos because many of them have requested us to upload many of the videos to make it very simple. So please, I want you to maximum use this kind of educational tool for your group discussion, for your classes. So we are using it for the nursing school students also. So this is what it is. Anybody in these two topics has any other questions? Was it useful?
No,
How is it? Were you able
It was
to
very much
understand?
useful, madam. Very much useful. Very nice. Very simply
thank
explained.
you so much, ma'am.
I think everybody can understand.
So few of the things are already there in the YouTube. So please, you can continuously use it. And if any, no other questions? Don't need to hesitate. It is our own session. So feel free to ask questions. Any doubts?
No doubts.
Shaila?
Good afternoon, ma'am.
Good afternoon. Any doubt?
Very nice session, ma'am. It was great, useful to all our nurses so that we can remember. You explained everything in a very easy and simple way so that we can understand, and we not only understand, we have to just follow it, ma'am. Thank you. Nice session, ma'am. Very useful.
Thank you. James, no questions?
Any doubts from my team?
James and team, nothing?
Ma'am, it's very useful. Actually, already we have attended this class directly. So in Mandya.
When I came to Mandya, sure, yeah. Okay.
This is second section for us.
Good, good. Okay. So if any of you feel any topics you want, you can also put in your remarks in the YouTube. So we will be able to make that videos be useful for many. So once again, I thank you all very much for being part of this and all your suggestions and comments. And I once again want to thank Ms. Pooja and HSSC team for giving me the opportunity. Thank you very much.
Thank you
Thank you so much, ma'am, for
ma'am.
accepting the invitation for today's session. The session was very wonderful. I can see the feedback in the comment section, and it was means very self-explanatory videos you have prepared, and we'll definitely refer the videos you have uploaded in your channel also. So thank you so much, ma'am, for giving the wonderful session.
Thank you.
Thank you, participants. Thank you.
Thank you. All the best. Bye.
Thank you.